Welcome to Tellico Health Chat, a series of programs about relevant health and wellness issues, produced and presented by the volunteers at Tellico Village Broadcasting.
Hello, and welcome to another episode of the Tellico Health Chat. I'm Ashley Hankla for Covenant Health. Today's topic of discussion is understanding stroke, from prevention to treatment. This presentation was originally given by Dr. Arthur Moore, who is a stroke center medical director for Fort Sanders Regional Medical Center in Knoxville. This presentation has been adapted for educational purposes by Fort Loudoun Medical Center here in Lenoir City. So we're going to talk a little bit more about stroke education, signs, symptoms, prevention, and treatment here locally in Loudoun County and things that are available to folks here in the village. In talking about some statistics about stroke, there are more than 800,000 strokes each year and 130,000 deaths each year due to stroke. The annual cost for Americans is about $36.5 billion. This is also the number one cause of long-term disability in the U.S. and the number 5 cause of death. Also, in talking about stroke, May is National Stroke Month. And we recognize a lot of different things as healthcare professionals in the month of May. We have Hospital Week, National EMS Week. We also recognize our nurses with National Nurses Week. So it's a very busy time for us at the hospital and other places as far as the healthcare field's concerned. And today, who's going to talk a little bit more about stroke with us today is Jill Ogle, who is our medical surgical unit nurse manager, as well as our critical care unit nurse manager. Thank you so much, Jill, for being with us today.
Thank you for having me.
I think stroke is a very relevant topic for folks here in the village. It's something that we need to get out and educate folks more about. I know you've been doing a lot about that, or a lot with that, here in the village. Can you tell us some about your background and how you became a nurse?
So, my nursing career probably started when I was 4 years old. I had some issues at birth. My mother, I was breech, wrapped in my cord. My mother cardiac arrested, and I had some breathing problems related to that. So at the age of 3 or 4, we would go to Children's Hospital fairly often, and there was a nurse that was instrumental in honestly shaping my nursing career. She would put my mom on a stretcher with a blanket and make sure she got some rest, because those emergencies never happen at 4 o'clock in the afternoon. It's always 4 o'clock in the morning. Mm-hmm. So she would take coffee out to my dad, and she would give me breathing treatments and feed me grape popsicles, and they're still my favorite to this day. So we fast forward about 20 years later, and Covenant Health was once again instrumental in being a part of my nursing career. I went to Fort Sanders School of Nursing. My original degree is a diploma in nursing. And I went back to Tennessee Wesleyan and received my bachelor's several years ago. Covenant Health also, Fort Sanders Regional, my dad had lung cancer and his treatments were there. He was in remission, but then he had complications and later passed away. He cardiopulmonary arrested. But the folks, again, at Covenant Health came to my dad's rescue and did everything that they possibly could and treated him like he was their family. So I started at Fort Sanders Regional Medical Center in 1998 as a student nursing assistant in the critical care areas, and cut my teeth there, if you will, and just I spent 18 and a half years at Fort Sanders Regional. I transferred out to Fort Loudoun nearly 2 years ago as the Acute Services Manager, CCU, and Med-Surg. And we have been working diligently on developing our stroke program, and yesterday we were surveyed, and so we have a primary stroke designation. As of Friday afternoon, we will be officially a primary stroke center, so we're excited about that. We've been working very hard, educating the public. Stroke's a very serious thing, and sometimes it starts out as just something mild like a headache, or you don't feel well, you're dizzy. Mm-hmm. Things that some of us may just cast off as, inconsequential.
Right.
So, but I will tell you that even if we hear a lot of people say, well, it was just a headache. I felt so silly coming to the ED. Mm-hmm. But I would rather someone walk into our ED with a headache and it be just a headache instead of a life-altering event.
Sure. But let's talk exactly what is a stroke. Can you explain to the viewers what happens? I think a lot of viewers are probably familiar with what a heart attack is. We've been educated a lot about signs and symptoms of a heart attack. So let's talk about what happens when you have a stroke.
So in a stroke, there are two types of stroke. There's ischemic stroke and then there's hemorrhagic. So in an ischemic stroke, much like a heart attack, you have a clot that occludes an artery. So it closes off an artery so that no blood supply, no oxygen can be delivered to the brain. And those are the most common types of stroke, is the ischemic. And depending on where that clot lands and what vessels are occluded or closed off, it affects one side of the body or another. So if you have a right-sided ischemic stroke, you're going to have symptoms on your left-hand side. So numbness, tingling, you may lose functionality of your leg or your arm.
Okay.
With a hemorrhagic stroke, that's a bleed. So you have a vessel that is under pressure, it's ruptured, and there's blood into that space into your brain, and it can cause an excruciating headache. Most often we hear folks describe a pop. They'll hear a pop in their head when they have a hemorrhagic stroke, or they'll describe a headache that is unlike any other they've ever had in their whole entire life, causes nausea lots of times.
Sure. Okay, let's talk more about prevention of stroke. There's several risk factors. A lot of times when we give this presentation out in the community to groups, we'll give out a scorecard. So it's kind of monitored red, yellow, green on where folks would fall, and you can monitor your own personal risk factors. I think a lot of times we recognize stroke in others, but sometimes we don't think about it with ourselves. So there's things that we need to be familiar with. So can you talk some about prevention and what those risk factors are?
So a lot of our risk factors are similar with other disease process, but there's some that are actually reversible or manageable. So our age, we can't change our age, but age is a risk factor. High blood pressure, we can manage that. Diabetes, obesity, smoking, sleep apnea. Most folks don't think about sleep apnea being a precursor to stroke, but it decreases the level of oxygen. It makes our platelets sticky, it makes our blood thicker, so therefore it's easier to form a clot. And sleep apnea and obesity go hand in hand. We lower our risk for obesity, we are lowering our risk for sleep apnea, and therefore we can modify that risk factor for stroke. Alcohol overuse, we do hear there are studies that show 1 glass of red wine is great for prevention of heart disease and stroke. However, overuse, an abundance, and even abuse of alcohol can be a risk factor, but it is modifiable. And then physical inactivity. Exercise is paramount. We hear that we've heard it for years. We hear it, there are new studies all the time. Just 30 minutes a day, 3 times a week is a good modification for physical activity to prevent stroke and heart disease.
Let's talk about recognizing a stroke.
So at the hospital, we do a lot of education with our staff, and the easiest way to remember symptoms of stroke or signs and symptoms of stroke is fast. Facial drooping, being non-symmetrical, even an eye. Something as small as just one lid drooping can be an indicator of stroke.
Maybe an uneven smile.
Tongue
Speech.
thickness. Yeah, tongue thickness. A lot of people will express not necessarily difficulty speaking, but they'll talk about tongue thickness, so their mouth just feels fuller. Arms. So if you're unable to move your arms well, or if a heaviness, numbness in your arms. Speech, garbled speech, unusual speech. We talk about word salad. So if someone's speaking to you and they seem to be, understanding what you're saying to them, but what's coming out makes 0 sense, or just comes out in a jumbled mess, and we all laugh about it all the time and make jokes. I can't tell you how many times I get tongue-tied in a day and think, oh, wait, is that a TIA? Is that a stroke? I mean, and not to laugh it off, but we all get tongue-tied, but it's that kind of thing, but this is unresolvable. Or, and then, of course, I just lost time. Thank you. Time is our biggest enemy, and it's our biggest friend. So time is of essence. the sooner you recognize those stroke symptoms and the sooner you get help, the better off we are. We have, just a small window of time to treat that stroke with good outcomes. So once from the 0 hour to 4.5 hours, we can treat, if it's an ischemic stroke, a clot-like stroke, we can treat with TPA, or after that 4.5 hour point, we can go in and do clot retrieval. But there again, those have time limits as well. The neurointerventionists and the neurosurgeons, they make those decisions. We work collaboratively with those physicians to make the best decisions for our patients.
Sure. So in talking about fast, we need to remember to think fast. Also, just wherever you are, be sure you get to the closest emergency room. It doesn't matter where you are. If there's one across the street, just get there. Call 911, have that ambulance make that determination. So let's talk more in talking about treatment of stroke and specifically talking about time being critical. We hear the terms last seen normal.
Right.
Can you explain to viewers what that means and how important that is if your loved one has had a stroke or stroke-like symptoms?
Right. So last seen normal is you will hear, if you are at your home and you call 911, the guys on the truck, they're going to say, well, what was their last seen normal? And what that means to you, when was the last time you recall seeing that person act in full capacity? So they were speaking clearly, they were thinking clearly, they were moving all extremities equally and in correct form. So that's the most important element for us, is the last seen normal, because that tells us how much time we have to treat you and what our treatment options are at that point. So wake-up strokes are the thing that get us most often. Folks will, many times a stroke will cause drowsiness, will cause just fatigue. Folks want to go lay down. They'll lay down. They wake up 2 or 3 hours later and they've had a stroke. We refer to that as a wake-up stroke. And those last seen normals, sometimes people go to bed, it's 8 or 9 hours that they've slept. They get up the next morning and they can't move one side or the other, or they're not speaking clearly. And that's when we get into a little bit of trouble with time. We limit our treatment options at that point. So, if you're feeling poorly before you go to bed, maybe you call the doctor's office, maybe or maybe go to an ED just to say, hey, I've had this headache. I'm not moving as well. I'm walking. I'm stumbling. There's no harm in being wrong. Right. I tell this to my staff all the time. We talk in the community, we speak to groups. There is no harm or shame in being incorrect. You're not having a stroke? Well, great. That's awesome.
Awesome. Right.
Awesome. But it would be a shame if you went to sleep and woke up the next morning and your life was, irreversibly, irreversibly changed. It's just, like you said in the opening remarks, it's devastating. It's the number 5 cause of death and disability in in the United States. It's a big deal, and it's preventable. That's the big message that I want folks to take away. It's preventable. It's changeable. The earlier we intervene, the better outcomes we have.
Awesome. Okay. So also in talking about May, we're into the summer months now, but May was a busy month for us. We recognize a lot of different healthcare professionals in the community, but also we installed a new CT scanner at Fort Loudoun Medical Center, which technology plays a huge role in the treatment of stroke. Jill has talked a lot about time, the importance of calling 911, making sure those EMS professionals who we work so closely with are involved. Our new CT scanner is, not only does it provide outstanding images, but it also is able to provide a lower dose of radiation to folks by 50%. Yes. The way our hospital is designed, you're able to get directly from the emergency department to our imaging department for that reason. It's designed for that layout to be in and out. But also, what are other things they do? You've mentioned TPA. Can we talk about that some, and who does that? Who administers that? I've heard you, I also want to say, I heard you mention to the fire department here in Tellico about stroke prevention or treatment happens in your driveway.
That's right, yes.
So let's talk about that some.
So at Fort Loudoun, we are tremendously blessed, if you will. We have a set of guidelines. They're called continuity guidelines. They were developed in conjunction with our EMS, our stroke team, neurointerventionists, and then our staff, our nursing staff. We are the only hospital across the country that have these guidelines, and what the difference that it makes is that you literally start your treatment in your driveway. You dial 911, an ambulance shows up in your driveway, and that is where your treatment starts. They can start with blood pressure medicines. They carry labetalol, hydralazine, and a couple of other medications on the truck in order to get that blood pressure. We want to get that blood pressure down because the higher that blood pressure is, the more likely it is that you can convert from an ischemic stroke to a hemorrhagic stroke. And then, of course, we get in a lot of trouble with outcomes when we have that conversion issue. But so that's super important. I can't stress this. We are the only hospital in the whole entire country. And just to brag on us a little bit, if you don't mind, yesterday our Joint Commission surveyor was there, and she was so impressed with these guidelines. She said I do this all over the country every day of the month, and I've never seen this much attention to detail. I've never seen an algorithm so well thought out and it's patient-centered, and it's evidence-based practice centered, and it's
Right.
ER to hospital. So it's not like, oh, it just happens on the truck. So the truck pulls up in your driveway. You start getting those life-saving stroke treatments. They get you to Fort Loudoun Medical Center. The doctor meets you at the ambulance bay door, does your assessment. You go straight to a CT scanner. So I'm not 100% sure, but I think we're in a CT scanner within 8 minutes from ambulance. Once you arrive on site to the CT scanner, you are getting a CT within 8 to 10 minutes of arriving at Fort Loudoun Medical Center. And then once we can do CT, of course, just a plain CT, a plain brain, which is what we do as diagnostic. But the neurointerventionists, they love a CTA. So with our new CT scanner, we can do that CTA with a beautiful, clear images so that they can be sent over. The neurointerventionist is looking at that most times before the radiologist in our own hospital is looking at it, because they're that, everybody's on the phone, everybody's ready to act.
Sure.
Because again, time is of essence. Then once you come back to the RED, if you are having an ischemic stroke, so you have a clot occluding your vessel, we start mixing that TPA, provided that you're a candidate. There are some risk factors, and there are also some exclusionary criteria, and the physician goes over that with you. If you're unable to speak, of course, they're going to go over that with your family. You don't have a family member present, they're going to make the best decision for you based on all of all the information they know about you. That TPA, you're given a bolus. It's administered over a designated period of time, and then you will stay there at Fort Loudoun Medical Center, provided there aren't other complications. So, we're looking to keep our community members in our community hospital. We're looking to take care of the folks and leave them in their own backyard. That's our goal.
Okay, so in talking about TPA, can you explain to us who might be a candidate for that? I think it's important to recognize, as part of our educational piece, that not every single person who we think is having a stroke, or who the physicians have deemed your CT has come back, you are in fact in an active stroke. Can we talk about when that's important to give and when not? Because everybody's stroke journey is different.
That's true.
And their treatment is different. They're not all going to be given the same exact thing. So we're able to evaluate that. Can you talk about that?
So I spoke about the TPA and risk factors and exclusionary criteria. The biggest exclusionary criteria for TPA would be blood thinner. So if you're taking Coumadin, Eliquis, or any one of the number of blood thinners, and you're most likely going to be ruled out for a candidate for TPA. However, that doesn't mean that you're a lost cause.
Sure.
As I mentioned before, we have retrieval processes. So we would be on the phone with that neurointerventionalist, and we would say, this person is taking Coumadin. We don't have enough time. Their last seen normal was 4 hours. We don't have enough time to reverse them. And it's also very dangerous to reverse somebody. You could actually potentiate that stroke. So they would be on the phone with that neurointerventionalist, and at that point, it might be that you are shipped out to have a clot retrieval. So they would use one of the large vessels either in your groin or your arm. They insert a small catheter and then go up, and they literally can retrieve those clots and pull them out. We did have a gentleman who presented with a headache and indigestion, and he literally had a stroke as the doctor walked in. It developed as the doctor walked in the room.
Wow.
And we were able to give him TPA. We did send him, because his blood pressure was so high and he had some other complicating factors, we did send him to Fort Sanders Regional, and he was discharged a week later with 0 complications. He had no residual at all, and he has come back and to to tell us, his story and thank us for what we did because we acted quickly.
Wow.
And we have lots of those, those stories, if you will, where folks have, just because they recognized or they didn't feel well, and we've been able to use TPA or the clot retrieval process.
In talking about treatment options for stroke, we also want to talk about what happens after a stroke. There are definitely some other options as far as therapy is concerned. Fort Loudoun Medical Center is a part of Covenant Health, who partners closely with the Patricia Neal Rehabilitation Center. Can you talk to us about that partnership and how we translate that into our county here and what we offer?
So we are the only organization, health system in this region that actually has a one-on-one partnership with a award-winning rehab center, Patricia Neal. They've won Crystal Awards year after year. I believe they're 4 or 5 years in a row, and their stroke program is nationally recognized and renowned. And so once our patients have had their treatment and they're ready for their recovery, if they are doing inpatient treatment, then they would be transferred to Fort Sanders Regional to the Patricia Neal Rehab Center, and they would complete their stroke rehab there with their families. Again, it's Patricia Neal does a great job of incorporating the patient and the family and making everybody aware and getting everybody up to speed and everybody on board about that treatment program. And then locally, if the residual is not as severe and you don't need inpatient therapy, Pam Allard at our therapy centers at Fort Loudoun Medical Center, they do outpatient therapy. And also, while you're in the hospital, you'll start that rehab process immediately. So Justin and Pam and all the staff in the physical therapy department, they come and they start that stroke rehab day 2. So immediately we're working on getting that person up out of the bed, getting everything moving, and trying to regain as much function if we've lost any at all.
Sure. And in the past, Pam and some of her staff, she is a speech therapist, Ann Ross, a physical therapist and occupational therapist, have had a segment here on the Health Chat where we discuss in depth about neurological rehabilitation.
Right.
And some of those focuses and efforts. So if you're interested in that program, it's out there as well, which can be a transition from this one. In addition to the rehab and the neurological rehab center programs that we offer, we do provide educational aspects to children. You were talking about Patricia Neal, and I believe there's a book out there called Can My Dog Have a Stroke?
Yes. So interestingly enough, we live in a world where our children are being raised by their grandparents, or they're in blended families. So we recognize that need. We had a young man at a school presentation asked the question, can my dog have a stroke? And so our stroke team, Covenant Health stroke team, put together this book. It's geared to 3rd and 4th graders, and it's a great teaching tool. Just talks to them about what the signs and symptoms are. How do you recognize a stroke? What happens? What should you do? But it puts it on their level, because anybody at any time can have a stroke. And so what if it's you and your 9-year-old? You want them to be ready to help. So.
Great. And of course, if anyone is interested in that stroke program for children, we can have some of our stroke educators get out in the community and talk to those folks, whether it's a church group or a school age group of any kind. We'd be happy to do that. So
absolutely.
Thank you so much, Jill, for being with us today.
Thank you. It's my pleasure.
I know Fort Loudoun is very passionate about stroke education in this community. We do live in so-called the stroke belt. The southeastern portion of our country is definitely the highest in terms of death and those types of things. So we definitely appreciate you coming out.
Thank you.
Jill and the stroke team at Fort Loudoun Medical Center is also giving community presentations about stroke education. We've done quite a few over the past couple of months, and we're going to continue to do those. We get out in the school system. We get out in clubs and organizations. So if anyone is interested in those, you can call our call center at 865-271-6060, and we'll be happy to connect those with you guys and get that education out there. And if you have any questions or concerns for anybody at Fort Loudoun Medical Center or Covenant Health, you can also call that call center number 271-6060. Jill would be happy to answer any questions anyone has. And as always, thank you for watching Tellico Village Broadcasting, and have a great day.